Welcome to my presentation of brain development in the utero. We will be discussing the formation of the brain, fetal behavior, and fetal alcohol syndrome. The first few weeks of development, the baby is starting off early in the formation of the brain. Already at 3 weeks, the neural plate is formed, and you can see the primitive cerebral hemispheres. The neural plate will eventually become your brain and spinal cord. Already at 5 weeks, the brain has started to grow. At 8 weeks, the structure of the brain and nervous system is already in place. How baby brains develop 2014. Between weeks 13 and 20, white matter, specifically the intermediate zone, increases in size by a factor of 3.8 per et al. 2006. Around 15 to 21 weeks, the fetal spinal cord goes through a growth phase. At 21 weeks, there is histological evidence that the brainstem and internal capsules form. At 22 weeks, we see the formation of the thalamus, Perez et al. 2006. The temporal lobe begins with the formation of the hippocampal primordial at 9 weeks. This area is where the cerebral hemisphere is developing. This hemisphere consists of 4 structures: the ventricular zone, intermediate zone, hippocampal plate, and marginal zone. Per et al. 2006. During the 15 to 24 weeks, the hippocampus is formed. Around 24 weeks, the vertical orientation is lost, and the brain is starting to look more like the adult version. The cerebellar starts to form between 5 to 6 weeks and will continue to form after birth. End of week 8, the vermis is formed by the fusion of the cerebellar hemispheres. The vermis and cerebellar hemispheres have their shape at 22 weeks. At 6 to 7 weeks, the brainstem is matured. The medulla, pons, and midbrain are formed. The brainstem, however, is not completed until about 7 months after the baby is born. At 8 weeks, the pons develop. The function of the pons is producing sound through vibrations. Fetal behavior, according to Perez et al. 2006, is characterized by spontaneous and reflective movement. These movements require certain neuromuscular development to occur and having a normal central nervous system. Starting around 7.5 to 8 weeks, the vertebrae starts to flex and extend. Starting at 9 weeks, more complex movements start, which include moving the whole body. Movement is still involuntary currently because of there being no cerebral input. Week 12, there is isolated random movement of the extremities. Week 14, we see more organized movement. Week 26 through 32, extremities are moved independently. Around 37 to 38 weeks, movement frequency decreases. Starting around 34 weeks, there is an increase in mouth movement. Mouth movements include opening and closing, swallowing, and protruding the tongue. Fetal alcohol syndrome occurs when the mother drinks alcohol while pregnant. This causes damage to the developing baby's brain cells along with other organs. Behavior issues occur, which include the child's ability to learn, problem solve, and understand consequences. Science 360, the Developing the Brain, 2009. Other abnormalities include small face size, changes in facial features, and brain structure differences.